this a second. Yeah, okay.
Hello, good afternoon and welcome to North Tynesyde's Health and Wellbeing Board. My name is Councillor Margaret Hall. I'm Chair of the Board. This meeting is being streamed live on the Council's YouTube channel to enable members of the press and public to observe the meeting, and I welcome anyone who is watching. Before we move on to the agenda, I would first like to make it clear who is participating in the meeting and explain how we intend to conduct the meeting. In order to check who is at the meeting, I would like to ask everyone present to confirm their attendance at the meeting. In order to do this, I shall now call out the names of the members of the board. After I call your name, please turn on your microphone and camera, introduce yourself so that we can be sure that you can be seen and heard. Councillor Muriel Green.
Hello, everybody. I'm Muriel Green, Wheatslade Ward and Deputy Chair of the Health and Wellbeing Board.
Councillor Matt Wilson.
Hello, yes, I'm present. Councillor Matt Wilson, Preston Ward in North Shields.
Thank you. Councillor Tommy Mulvenna.
Hello folks, my name is Councillor Tommy Mulvenna and I represent the Valley Ward.
Councillor Willie Samuel.
Hi, Willie Samuel, Councillor for Cullercoats Ward.
Wendy Burke.
Hello, I'm Wendy Burke and I'm Director of Public Health.
Thank you. Jackie Old.
Afternoon, everybody. I'm Jackie Old. I'm the Director for Children and Adult Services.
Very festive.
Thank you.
Leslie Young-Murphy.
Hello, good afternoon, everybody. I'm Leslie Young-Murphy. I'm the Exec Director Nursing, Chief Operating Officer, North Tyneside CCG.
Paul Jones.
Good afternoon, everybody. Paul Jones, Director of Health Watch North Tyneside.
Michael Graham.
I don't think Michael's with us this afternoon.
Claire Riley.
Hi, I'm Claire Riley. I'm the Executive Director of Communications and Corporate Affairs for Northumbria Healthcare.
Lisa Long.
Good afternoon, everybody. My name's Lisa Long. I'm an Associate Director for CNTW and here on behalf of KDAR Calais.
Okay. Susanna Thompson.
Hi, I'm Susanna Thompson. I'm Medical Director of Tyne Health GP Federation.
Craig Armstrong.
Again, I don't think Craig's with us.
Right. Ian Warren. No. Dawn McNally.
Good afternoon, everybody. Dawn McNally from Age UK North Tyneside.
Andy Watson. No. Cheryl Gavin.
Hiya, Cheryl here, Director of Helix Arts.
Hello. Dean Titterton.
Good afternoon, everyone. Dean Titterton here, the Chief Exec of YMCA North Tyneside.
Karen Sodi.
Good afternoon, Karen Sodi, deputising for Richie Rickaby, representing Tyne and Wear Fire and Rescue Service.
Thank you. And Julia Charlton.
Good afternoon.
Hello. It's your first meeting and you're most welcome. Thank you. Have I missed anyone who is at this meeting?
Hello, can you hear me?
Yes.
Right.
Yes. Hello.
Hello. This is my first meeting. I'm the recently appointed new chair of Health Watch North Tyneside.
Thank you. And as I said before, it's your first meeting. You're most welcome. Right, I think that's all the members. I now go to the officers who are attending this meeting. Scott Woodhouse.
Good afternoon, Chair. Scott Woodhouse, Commissioner Lead for Adults within the local authority.
Mark Taylor.
Good afternoon, everyone. Mark Taylor, Strategic Commissioning Manager for Children's and Family Services at the Council.
Michael Robson. I think.
Afternoon, everyone. Michael Robson, the Administrator, yes. And I think, Chair, there are two other people I can see that we haven't yet mentioned. Jill Harland.
Right. Hello, Jill.
Hi, good afternoon. I'm Jill Harland. I've just joined Northumbria Healthcare Trust as a new consultant in public health, and I'm here as an observer this afternoon. Thank you for letting me attend the meeting.
Thank you.
And I think, Chair, we'll also have Anya Parody from the CCG.
Hello, yes, Anya Paradis from North Tyneside CCG, Director of Commissioning and Contracting. Thank you.
Thank you. Have I missed anyone else between Michael and I? No. Then we start on the agenda items. Have we got any apologies for? Oh, we have. Yes. Any apologies for absence?
Yes, Chair. So we'll have apologies from Councillor Karen Clark, Cedar Carley from Cumbria Northumberland Town and Weir Trust, and also Richie Rickaby from the Fire Service. And as we've, if you may allow me, as we've already mentioned, Councillor Samuel substituting for Councillor Clark, Lisa Long substituting for Cedar Carley, and Karen Sodi substituting for Richie Rickaby.
Super, thank you. That brings us to declarations of interest. Are there any declarations of interest from those present at the meeting? There being none. The minutes of the meeting, item 4, where can we confirm that these are a correct record of what took place? And I shall take it that the minutes are confirmed if no one indicates.
Agreed.
Thank you. Item number 5. This is the major presentation for this afternoon's meeting. We are to be presented with the details of 2 emerging strategic documents, the Children and Young People's Plan, but first we're going to look at the Future Care Plan. These plans will enable us to plan our own work for next year. As you all know, we took the decision to have a look at the work we were doing and was it fulfilling the role and the needs, and we have taken on that we will change and make a new plan for the Health and Wellbeing Board. These 2 items, these 2 plans will form part of that work for our future next year. I think a copy of the plan was emailed to members of the board yesterday, and I hope everyone's had an opportunity to view it. I know I haven't got it, so I think what I'll ask is that we'll check that everybody's got a copy and then maybe ask you, obviously, after the presentation in your own time to read it and give us comments back. I understand Leslie Young-Murphy is going to lead us through the Future Care presentation. Thank you, Leslie.
Thank you. Just going to share my screen, Chair. Just going to check, can people see that?
Yeah, yes.
Great, okay, thank you very much, Chair. I'm going to present on behalf of our programme board. Obviously, this is a partnership plan. It's North Tyneside Place-Based Transformation, which is the Future Care Programme Board, and I happen to chair that. Obviously, all of the partner organisations are on the bottom, and I'm just going to talk through the development of the plan, the principles behind it and the structure, and then how we're going to manage and monitor the impact in terms of delivery. And Scott is going to come in to support in terms of answering questions, as well as Anya. But I'm conscious that there's a number of people sitting on the Health and Wellbeing Board who've been involved in this. So the partnership plan, as you can see there, is we're taking an asset-based approach to that in order to support people to live well and improve health and wellbeing outcomes for the population. Originally, it obviously builds on existing services as well as the incremental developmental work we've seen over the years across older people, across working age adults particularly, but also encompasses the transformation programmes across the system, across health and social care, to deliver sustainable care closer to home for GP registered population. The reason the GP registered population is important is that our GP registered population go beyond the boundaries of North Tyneside. North Tyneside. So the context of the plan, originally health particularly, as well as social care, had to set up a phase 3 COVID response in terms of how we stepped up services. And at the same time, following on from our previous plan, we needed to refresh the place-based plan for North Tyneside. So we used the opportunity of the learning from the first wave of the COVID pandemic, and we worked with partners to identify the lessons learned, as described by each of the partner organisations, think about some of the practices that we wanted to embed that arose from the pandemic, recognising the significant transformation change across the system, thought about and included the requirements and recommendations laid out in the national and local documents that we've already got, and then brought together a number of our priorities across the system to help inform our plan as presented here. Partnership is really important, and we recognise and celebrate the importance of that on a system plan. All of our partners have contributed actively towards the plan, as you can see there, and they've had the opportunity to comment on that. And that's across health and social care, as well as some local patient groups, including Health Watch, Community Health Forum, and members of the Patient Forum. There's a number of cross-cutting themes, and we'll talk a little bit about that in a moment, but clearly across the partnership, we've agreed the principles for partnership working. No one organisation can deliver this on its own. It's not seeking to replicate the individual organisation's responsibilities or their priorities, but looking at commonalities where really we're better together to deliver for the residents of North Tyneside. There's a cross-cutting theme in terms of how we respond over the next few years to the physical and mental health consequences post-COVID, how we work together differently to tackle inequalities, including digital inequalities, and we've got an exciting programme in North Tyneside to do that. We're going to develop a cross-system communication strategy, and this is where we rely heavily on the expertise of Claire and her team. Workforce strategy is going to be really important, particularly as we see new roles evolve with the advent of the primary care networks, as well as the system transformation needed to ensure sustainable health and social care. And there's also a significant digital transformation programme that's going on across the North East, but particularly in a number of our organisations in North Tyneside. And as you can see to the right there, as you would expect of a place-based plan, it aligns with all of the key strategies. The key programmes of work are population health management and prevention, including how we look at addressing inequalities. And obviously we take our lead from Wendy Burke in relation to that, and that's a cross-cutting theme across a number of the programmes. The implementation of the North Tyneside Children and Young People Plan, which Jackie obviously is going to talk about, and they're the lead agency for that, but to ensure that we get the synergy across transitions across the life course between children, young people, working age adults, older people, and at the end of life, we need to make sure that we've got a place where we look across those transitions. We're committed to improving support for carers. We've got a programme around living well locally in North Tyneside, which includes the transformation of community provision. The community mental health transformation, which is a huge programme across North Tyneside, involving and led by the CNTW Trust, and each locality, so for us, North Tyneside, has got their own plan depending on the various services that are already in place and commissioned, and we'll hear more about that at a subsequent date. Aging Well in North Tyneside, which is our new older people's strategy, which includes frailty fall services and mental health provision for older people. Continuing the digital transformation, and crucially at this time, rolling out the COVID-19 vaccines. This is an example. This one's Aging Well, but we've tried to take a consistent approach in terms of how we approach each of the programs. We want people to be healthy, which is self-explanatory. We want people to be active, in line with the Active North Tyneside, and we want people to be connected to their family and friends, their communities, but also we want people to be connected from a digital point of view as well, particularly where we know there's inequalities in relation to that. Our principles are about that we will make sure that we deliver integrated services across health and social care, digital systems. I'm not going to read all of that, you can see it. They're person-centred, they're safe, and that we are inclusive. And I think the key thing for us is to make sure that we've got that golden thread to make sure that all of our services are accessible and responding to the needs of those people who've got physical disabilities or learning disabilities, and making sure that we are making reasonable adjustments across the system. This is our governance arrangements, and as you can see, this the North Tyneside Future Care Programme Board works on behalf of the Health and Wellbeing Board. We have an executive, which the chief execs of all the respective organisations are included, and we also report into our own organisational boards depending on the membership. We'll have 3 large programmes. One is the Best Start in Life, which is a Children and Young People's Plan, which obviously will need to change that in line with the new strategy, and that is led by the local authority, and Jackie will be talking about that in a moment. Living Well locally in North Tyneside, and the priorities are around the development and delivery of community services, along with primary care networks, to make sure that we provide the right response to local people to support the ongoing health and wellbeing. Building local resilience and improving access. Key thread is around prevention and self-management, and particularly working across health, social care, community and voluntary sector teams. Aging Well locally, again, is picking up in terms of our Aging Well strategy, and the principles haven't changed. We've had these for some time and we're still committed to delivering that together. Promoting independence, reducing isolation and loneliness, making sure that we've got a good integrated provision to provide both proactive care as well as reactive care, and making sure that whenever possible we support people to live well at home, and we delay access into permanent nursing or residential homes unless that's indicated and that's the individual's preference. As I said, we've got a huge transformation programme which is around mental health, learning disabilities and autism, and the community mental health transformation programme is going to be a key thread running across all of the services, because whilst it's a CNTW programme, it cuts across community voluntary sector and all of the services that Northumbria deliver, as well as GPs. So it's really important that it's a system. Across all of the themes is making sure that we promote self-care, increase social participation, and continue to improve access to services and respond to the public. We've got a number of enablers, as you would expect, and clearly one of the key enablers that we need to work on together is make sure that we've got a responsive workforce and organisational development plan. Comms and engagement, IM&T. We already have a partnership, medicines optimisation partnership group, and quality improvement in education group that continues to deliver across the system. Oops, it's just decided to freeze. Sorry about that. We've also got a performance framework, and just for those of you who don't know, in 2016, which seems like a lifetime ago now, North Tyneside, Northumberland CCG, as well as North Tyneside Council and Northumberland County Council, together with the two directors of public health, and Wendy was involved in that, worked with the King's Fund and other partner organisations to look at how we could define short, medium and long-term outcomes for the North Tyneside and Northumberland system. And the whole point of that was to consider what the population-based models of care could look like, what we could deliver better together as providers and commissioners, and think about what we currently had in the system that was already being collected to map against this, and then over time it would evolve. It was proposed that these outcomes were adopted by the programme board, and that was agreed. And I just wanted to give you sort of an overview of what they are. And as you can see, improving population health and well-being there. We've got three. I'm not going to read them, but I think the key bit is, you know, the threads are around prevention, and that we work together as a system to address the wider determinants of people's health. Delivering high quality coordinated care, making sure people have got access to services when they need them, that the health and care system works to reduce unplanned hospital admissions and the time people spend in hospital. We know the best place for people to be is in their own home, regardless of where that is. And that we've got the right mechanisms in place to support recovery or from either illness or injury, and that we support people to stay well after treatment. And you can read the rest, but I think the key elements there are that together we can make a difference in terms of how we deliver high quality coordinated care. We've also got metrics in terms of improving the quality of life and experiences of services. And what we want to see is that people have a positive experience of health and care services, regardless of where they're delivered, and that people with long-term health and care needs are supported to improve their quality of life. And people who provide care and support are supported to manage their own health. And a number of organisations, which I know members will be aware of, are part of the Better Health at Work Awards, and that commitment to make sure that we support staff to stay well, because we know happy, healthy staff deliver better outcomes for local residents. Clearly there's a support and empowering staff, and then at the end it's about making sure that we are managing our resources effectively. We all know the economic challenges across health and social care, community voluntary sectors. Indeed, with the COVID, that's been compounded, and certainly for our residents. So we need to work together to make sure we're making the best use of public money. So those are our health and care outcomes. We report on these. Some of them are short-term measures, which are used as proxy indicators to identify long-term health and social care goals, as well as overall health of the population. Some things only reported on an annual basis, but we report these at every meeting where we've got that information, and we continue to use those as an indicator in terms of our delivery outcomes. We've also got, obviously, you have before you the paper which provides the narrative in relation to our place-based transformation plan, and we would welcome feedback prior to it being finalised. It's in draft form at the moment. We'd like you to agree the programme areas for the Future Care Programme Board, which is made up of the partner organisations working on behalf of the board, Health and Wellbeing Board, and the residents. This will then be turned into, we've already got an action plan with key milestones, and we will monitor that through the board, and we will continue to receive the outcome measures at the board as a system, and where we need to take remedial action collectively, we'll do that. I'm happy to answer any questions. Scott, I don't know if you want to add anything, or whether you just want to come in to help me answer some of the questions.
Thanks, Leslie. Chair, if I may, just to support what Leslie said in relation to the local authority and the board and how that works on a collaborative basis. The strategy itself has been pulled together through that board and through the joint work, and it is consistent with our priorities and work that we're doing from a local authority perspective and adult social care. And as Leslie said, it will form part of and feed into commissioning intentions going forward into the new year. And as we've done in previous years, we will be bringing that back to the joint meeting of this board and the scrutiny committee early in the new year, just to follow that thread through between what the plan's saying at a really high level to then what it means on the ground and in relation to service provision, delivery, outcomes for individuals as well. I think from a local authority perspective, looking into the plan and the document, it's really clear that it's not just about one element of the local authority, adult social care. It's clear that there's a whole raft of elements of work that do feed into it, whether it be around good quality housing for individuals, whether it be about sort of the leisure offer that's in place to support people to be active. And we all know about the links between good physical health and mental health as well. But I think for me, in summary, it's a document and a plan that supports the initiatives going forward, and we want to work collaboratively and to seek the benefits and the outcomes from that. And as Leslie said throughout the presentation, we can't do it individually. We need to do it together as a whole system, and certainly the local authority from that perspective is fully signed up and joined into that process.
Thank you. I want to say how important I think this future care plan is, and thank you very much for the presentation. And certainly I realise now what a major part it's going to play in the future. And I noted in the report there was lots of new language which has come out of the situation we're in now, that use of new technologies and that need to communicate. I think I would sum it up as a fresh or a refreshened way and a modern way of looking at what the community, what we in North Tyneside as residents face for the future. And it's forming up to a very solid plan. And I know members will want to make comments and have questions. Is there any questions, please?
And Councillor Wilson, Chair.
Oh, now can I just, right, Councillor Wilson, how do I say, oh, right, it's okay. Councillor, if you'll keep me right, Michael, thank you. Councillor Wilson.
Thank you, Chair. And great, thank you, Chair. Thank you, Leslie, for the presentation. It's an impressive piece of work. It's huge, and I can't claim to have even begun to have properly digested all of it yet. I'm really pleased to see, and in your remarks as well, that partnership is at the heart of this, and it's about working together to achieve this plan. You spoke a fair bit, particularly in your early comments there, about digital transformation. I'm very supportive of digital transformation. I think it's important and necessary. I also recognise that it's expensive in terms of the upfront cost, and then it's sort of recovered through efficiencies over time. My impression is that it can mean lots of money invested on the sort of the system side in terms of creating those new digital solutions, but sort of proportionately much less on the kind of service user side. And the plan does acknowledge that service users certain groups can have difficulty with digital access. I guess I'm just wondering about anticipating what level of resource might be needed to ensure service user inclusion, and particularly when I see, mention of, VODA and the VCS, I'm thinking they need to be properly resourced if they're going to be part of that plan for getting people included. Thank you.
Do you want me to respond,
yes,
Chair?
please.
Okay, thank you. I think it's no secret. I know you've heard Paul. I'm not going to speak for Paul. Healthwatch championing the digital poverty strategy and challenge, and I'm really pleased to say through various discussions with Healthwatch, with Voda, with other colleagues around the table, we have secured some money from NHS Digital to explore what digital challenges the local population face and just understand what's needed across the system. We've also engaged with colleagues from Newcastle University and also Northumbria University. One of the colleagues, Katie Britton, is also on the ARC, which is the, as you know, is the regional research network. So we intend to work with local groups, with some members of the local community to co-design a piece of research really to gather people's views, bring in some experts as well to help co-create that, and really just get to understand what's important for people, because I absolutely agree with you. The technical infrastructure is one thing. So accessing that is one thing, but actually have people got the skills to do that? Do they have the right support? Where are our challenges? And if we are moving increasingly towards a combined face-to-face and digital delivery of services, it doesn't matter which service, we need to make sure that we've got the right systems and support in place for the future.
Thank you.
Thank you. That's really reassuring, and I'm pleased to hear that we have that that money coming through from NHS Digital.
Anyone else?
Could I just say a couple of words following up on that? I've had the pleasure of reading through 4 or 5 versions of this plan and commented on every one, and it's been really great to see the kind of views that people are sharing with us at Healthwatch are being kind of taken into account of this. And I think the digital point is absolutely a critical one. That actually we've done a lot of work over the last few months with various voluntary sector partners, including Age UK and the CAB and Voda in particular, both looking at what changes we need to make now to help people to make best use of digital, but also really think about what that needs to happen over the next few months and years to ensure that people don't get left behind. And I'm really pleased that this has been embedded into the plan in the way that it has. And I think that shows that actually the people who've written this plan have really hopefully listened to, and I think they have listened to what people have been saying to us and the partners, and it's embedded within the plan. So thank you very much, everybody.
Thank you. Any other comments? Yes, Jackie?
Yes, it's really just a comment. I think that you know, the plan itself, it looks to me like a really strong plan, and I think that you know, kind of credit to kind of the officers that have pulled it together. I think you can't underestimate just the complexity of all of the different strands of work that we've got across health and social care, and kind of the different organisations that play into that. And I think that pulling it together into such a comprehensive and cohesive plan has not been easy, but I think it's a great job. And I think that the other thing that I would say is that the plan itself kind of builds on a really strong foundation. And I think that strong foundation has really played out and come into the forefront over the last 9 months. And I think that you know, not only have we seen some outstanding work across the system, across health and social care, where they have absolutely transformed things overnight, but also the outcomes for individuals in North Tyneside has been much stronger than other places. And I think that that's down to the strong foundation, but also the strong relationships and partnerships that we've got. So real credit to everybody that's kind of contributed to this.
Thank you. Anyone else? Anyone else?
Margaret, it's Wendy here. I've got my hand up.
Wendy, yes.
Hi.
I can't see on the...
It's fine. I would just like to echo really what Jackie said. I'd just like to thank everybody for their input. I think I think the work that's been done, particularly over the last few months, but actually, you know, the preparatory work in the last 12 months in just setting the partnership up and refining the plan as we went, but also the challenges of COVID getting in the way. The fact that we've got such a comprehensive plan is testament to the good partnership working in North Tyneside. I guess for me, one of the things that we need to think about is as a health and wellbeing board, given the comprehensive nature of this plan and what we'll hear next in the children and young people's plan, is just to make sure that as a health and wellbeing board, we don't duplicate any effort, that we look at how we can integrate the efforts across the board. We can look to see maybe where there are any gaps or where there's any additional work that we might need to do to knit certain areas together. But I think at all costs, we must avoid any kind of duplication of workload. But great presentation, Leslie and Scott. Thank you very much.
Thank you. Before I move on to the recommendations, can I just say my thanks for that report. I feel a bit clearer about the future care plan. I think it's incredibly solid and good. And I think the only comment I would make is that there is, in one of your final slides, a question of the monitoring and the looking back and maybe checking what has been done and what still needed to be done. And those mechanisms, I think, need to start straight away, and that's a role of the adult social care scrutiny board. Thank you. I'll read the recommendations. Number 1, to receive the plan and provide our feedback. As requested and mentioned, please feedback to people should you feel the need. I trust the comments made today will be recorded and given due consideration and part of the report as it finalised. 2, note the cohesiveness of the plan with the priorities of the Health and Wellbeing Board. And 3, agree the programme areas for the Future Care Programme Board, which is made up of partner organisations working on behalf of the Health and Wellbeing Board and, of course, the residents. Thank you very much. Can we move now to item 6, Children and Young People's Plan, which is going to form part of all of this future for us. And I have a note, Mark Taylor is going to present this plan. Is that right, Mark?
Yeah, so Mark's going to present it, I suppose, just to tee off on that and to set some context to the plan itself. I think it's fair to say that this plan feels slightly different and slightly different in two respects. I think one is that when we set off with developing the plan, this started kind of back in October, November last year. And I think one of the things that whilst the local authority has taken the lead on it, I think that we've absolutely got to give recognition to both Leslie and the CCG for the part that they've played in leading this, but also the police who've been a really active partner in developing the plan. And alongside that, we've had education, again, who were co-opted to really help us grip kind of what the agenda and priorities should be. I think that the other thing that was significant in the development of the plan was that we wanted to really strengthen the approach that we took this year. And the approach was very much based on having a stronger voice for children and young people. So we spent a huge amount of time pre-March really talking to a variety of different children and young people to really help understand but also shape the context. And so a lot of what we've developed is to try and simplify kind of the priorities, but use it in a language that makes sense to children and young people. And I think that overriding the ambition of the plan is that we absolutely want North Tyneside to be the best place for children to actually grow up and thrive. And we're absolutely confident that it will be the best place if we kind of can only just crack on with the priorities that we've set. So I'm going to pause there and I'm going to hand over to Mark, who's going to talk through just some of the work and the priorities and kind of next steps in terms of implementation. Thank you, Mark.
Thank you, Jackie. Thank you, Chair. Just bear with me while I share my screen. Is that visible for people?
Yes.
That's great. Thank you very much. So yes, thank you for giving me the opportunity to talk to you about the Children and Young People's Plan for 21-25. I'm the theme coordinator, so very much supporting Jackie, the board, and the wider partners around this new plan. And what I'm going to touch on this afternoon is some of the kind of strategic context and how this fits in with the kind of wider planning framework, the approach we've taken to developing the plan with partners, the strategic vision and the outcomes that we're looking to achieve and how those resonate for children and young people and for families. I'm going to go through the main priorities and then just wrap up with the kind of current status of the plan, next steps, and an opportunity for questions and comments. So as a reminder, the Children and Young People's Plan is part of our strategic planning framework for North Tyneside. The Children's Board feeds into our North Tyneside Strategic Partnership Executive and is a key contributor to the Our People strand of the strategic plan. It is the I think the third Children and Young People's Plan that we have had for the borough. It's been a major piece of work, and it is something that we've started some time ago, some months ago, certainly this time last year. But on behalf of the Children and Young People's Board, there is a raft of joint working and clarity around the priorities within this current plan. And I'll also be touching on, I guess, some of the links across the broader partnership and clearly in respect of health and wellbeing and some of the other theme partnerships. Now, as a starting point, when we develop a new plan, we always look back and take stock. And within the strategic plan that you've received, you'll see that we have provided some of the context, we've provided some of the needs analysis, but we've also taken a look back at some of those key achievements. And I think it's a real record to be proud of collectively. Right at the top of the list of some of those key priorities was the Ofsted judgment in terms of our Children's Services inspection from back in March. And again, the quote there that Ofsted found in respect of our partnerships, that the partnerships are mature, well developed and highly effective. So again, it's not down to one agency, it's down to the collective and good joint working across the partnership that makes all of the difference. You'll see that I've referenced some of the other key programs, such as the Troubled Families programme, some of the other work around our what's called our Keeping Families Connected service, and some of the innovation and some of the things that we've done with through the Department of Education. We've got some, again, innovation around children and young people's mental health and emotional well-being, which is a real priority for us, and a strategic long-term partnership with Barnardo's. Again, multi-agency partnership there around support around mental health, which I'll touch on later. And a significant programme, as Jackie said, around education, so health and well-being, social care, education, and a Keeping Children in Schools programme to ensure that we can support all of our children in terms of their aspirations and ambitions around education, everything from early years and preschool through to the post-16 agenda and into FE, further learning, further training and employment and adulthood. So we have a real positive position to kind of start from in terms of the new plan, and some of these areas are both our successes today and our continuation of where we're heading next. in terms of what we've done in terms of through the priorities, as ever, this is not the totality of the work that we all do. It's the things that we felt that we could bring the greatest value to as a partnership, the things where really joint endeavour, joint action, a joint priority is really important. And in terms of the process then we've gone through, what I wanted to focus on here is that it has been some time in the development of the priorities. We have had a working group that was established when we were able to meet together collectively as a subgroup on a number of occasions earlier in the year. So we did come up with the priorities I'm going to cover later as a joint partnership. And in some of that earlier work earlier this year, we certainly did take into account the Health and Wellbeing Board's priorities and work plan and the discussions that we had there to ensure that the children's agenda, and back to Wendy's point, we are very clear in terms of role and remit and ensuring that our endeavours and our efforts and our resources are properly focused on the things that we need to prioritise, and we haven't got any duplication or indeed any gaps, and the links between the world of children's services and adult services is seamless and working across the system in a full whole system way. Some of the content, some of the information you will probably recognise if you're at the Health and Wellbeing Board back in March, where a number of us commissioning leads and Paul from Health Watch and others were there to present in terms of some of our intentions. So again, it's ensuring that the plans are well refined, consulted upon, our priorities are integrated, and that we've got that right focus across our planning framework. But clearly, as you'd expect me to say, whilst we've done a lot of work that started this time last year and a lot of work pre-lockdown, the impact of COVID has inevitably had an impact both on the preparation of the plan, but equally in terms of, and more importantly, in terms of our adaptive response from all of our services and all of the things that we've needed to do to support children and families and all of the services across education, health and care. So there'll be a COVID perspective to some of the priorities as I look through some of those. So that's really the kind of process we've gone through in terms of developing the plan. Now, again, Jackie focused on this, and this is referenced in the main strategic planning document. We have a very clear vision statement about making North Tyneside an even greater place for children and young people to thrive. We're all, including those who are vulnerable, disadvantaged or disabled, are ready for school, ready for work and life, cared for and supported. And beneath that, we have what we call our 5 I's. And again, it's reflecting that really the key thing for us was having a set of outcome statements that could really resonate across the system, and really from the perspective of children, young people and families, that if we can't clarify really what's important for all children and all young people and all families, then the real aim has been to make sure that we have that clear language, and certainly an extensive amount of co-production and consultation that has led to the outcome statements. And beneath these, there is a wealth of performance metrics and other aspects where we would be gathering intelligence on our outcomes and our impact and what that means, linked to these kind of 5 high-level outcome statements. We call them the 5 I's. So I am safe, I am healthy, I have opportunities, I have a voice, and I am happy. And I think that really sums up, very succinctly what we're trying to achieve for the borough. I will now proceed to go through each of those areas and to highlight some of those key priorities which are in the main strategic plan, the high-level plan. So our first one is safe. We have our multi-agency safeguarding arrangements that have been now in operation for a full year, and we'll be receiving an annual report on those at the next Children's Board on Monday. So everything around multi-agency safeguarding, and as I've touched on in terms of Ofsted, that certainly we have a really strong base here, but our priorities building on that. We will be refreshing our prevention early help strategy. We will be focused on contextual safeguarding. So some of our strategic and operational partnership arrangements to keep children and young people safe through the MSET arrangements are being reviewed through a working group. A new multi-agency adolescent service. This builds on some of the innovation work around supporting children and families with children on the edge of care, and particularly as we know from our needs analysis where certainly there are additional needs to support young people in terms of family support and ensuring children don't unnecessarily come into the care system. And we will equally be focused on a refresh of our neglect strategy, and again a working group, and that's a big priority for us in 2021 around taking that forward. So a raft of priorities around safeguarding under the leadership of our multi-agency safeguarding executive board. Our second I is the I Am Healthy, a range of priorities here, covering many of the things that you'll recognise in terms of some of our 0 to 19 public health services, our health visiting support, and some of that work, again referencing the Best Start in Life that Leslie highlighted in the Future Care Plan. So everything about that kind of early life is a real priority for us. And then some of those other priorities around stop smoking services and healthy weight and alcohol-free childhood through the work of our multi-agency groups, the Healthy Weight Alliance group, the North Tyneside Alcohol Partnership, and equally some of the other work we're doing around supporting some of our sexual health services through our sexual health network, and ensuring that across our range of services and public health services that we have a range of provisions and oversight there around the I Am Healthy. I will be coming on to children and people's mental health and emotional wellbeing a little bit later. Opportunities, a big focus in this area around education and learning and support in that respect. And ensuring we get things right from the earliest phases, preschool, but then all the way through school age support and beyond. There are, again, this is about our aspirations for all children, but there will be a focus on narrowing the gap and support through, for example, our pupil premium, which is the additional resource we have to support vulnerable children in school that need additional support. And ensuring we get all of the transitions right between the various phases of education and learning. And we've always had a real focus around special educational needs and disabilities 0 to 25, so all the way through up to 25, and within that an inclusion strategy. But that certainly isn't purely an education strategy, it's an education, health and care strategy to ensure that we can fulfil those ambitions, to ensure that everybody has the opportunities for support, and that we ensure that children and people get that support in borough and are able to access their local school and all of the support around their health and care needs within the borough. We are focused on early help and our model there in terms of special educational needs, to ensure that, as you'd expect, it's a whole system approach. There will be children, young people with very complex needs, and there'll be other children, young people with a level of additional needs that where they will be supported in mainstream schools. So an early help model and some early intervention at that point. And again, reflecting across the age spectrum, we're in the process of reconvening the working group, which I think has taken place in the last couple of weeks around our all-age autism strategy. So again, that's another one of those key priorities for 2021 to prepare that. Jackie mentioned that the huge importance we place on engagement with children, young people and families, and the whole I Have a Voice. We will continue to work through a whole raft of different approaches. We do have the benefit of some really strong engagement arrangements with children and young people in terms of some of the kind of democratic committees that the young mayor and others are part of, and some of our Children in Care Council and our Special Educational Needs Youth Forum. So there are a range of mechanisms there that are supported by our participation and engagement team and others, but equally it's ensuring that we continue to keep our close links to our parent carer forums, our carers centre and carers networks, and ensure that we all of our approaches, our strategic intent and our services and our support again comes back to the being able to be resonated against our 5 Eyes and the priorities that we have that all children and young people can recognise. So that is a huge and clearly a cross-cutting priority which features across all of the other work of the plan. And the final I of the 5 Eyes, we have the I Am Happy, which has a real focus on emotional well-being and children and young people's mental health. It's been an area of a real focus for us over a number of years. I referenced earlier some of the strategic alliance work with Barnardo's, that longer term joint working with all the opportunities that brings, and which is very much on a focus on prevention and early intervention. I guess it's particularly timely as we come towards the end of our first term of children being back in school after lockdown. There's been a huge amount of work done in schools to help prepare schools and to help to prepare young people for being back in education. We have used a lot of innovative technology to provide training and support through the likes of a Google Classroom approach, through some of our training materials for teaching staff to be able to support pupils with any of their emotional and wellbeing needs on returning to school. We are prioritising a whole programme of mental health first aid in schools and a raft of other things around supporting children and people's mental health, but trying to make sure we do as much as we can around prevention and early intervention and resilience around mental health as possible. So again, a real partnership endeavour there that builds on existing good work around that area. So that, in summary, covers our 5 Eyes, some of our key priorities that we are working on. The plan that we circulated, the high level plan, that's a draft document. We would certainly welcome comments and feedback. A colleague in Children's Services, Mark Jupp, is holding the pen, and either Mark or myself would be happy to receive any comments or feedback to support the final drafting of the plan, which will need to go through the sign-off processes. And as for the future care plan, we have, as you'd expect, a detailed action plan and work plan with a raft of kind of key milestones and all of the metrics that support all of that. And it will be subject to our regular reporting back to the Children's Board, into Health and Wellbeing Board, and up through to the NTSP Executive. So that's really the process in terms of the kind of next steps for the plan. That is as much as I wanted to cover at this point. So if that's okay, then I'll happily take any questions or comments at that point. Thank you.
If I may just explain, during the duration of your presentation, Mark, we appear to have lost Councillor Hall. So Councillor Green, would you be willing to just take the chair for a short period of time to allow Councillor Hall to return? Thank you.
I was going to come in with, right, I was going to come in with a question. Do you want my, right. Okay, thank you. Yes, that is an absolutely sound presentation, and I know how much work goes on, both health and social care, health and within the council's departments looking after children. There's a couple of sort of observations that I always feel it's just a bit missing, if that's at all possible. The one thing that we have always looked at is the gap between the children who are healthy and they're not healthy, and the children who are, you know, have good education, not good education. I just wonder where your plan actually fits into that sort of thinking in terms of bridging the gap between those that are able, those that are healthy and those that are not. It just seems to me that we're missing something here. And I also wish, I think it's a brilliant plan, don't get me wrong, but I just wonder sometimes if we could somehow look at a holistic approach to children as well as just the health and the education side, because there's such a lot about housing and families and environment that affect children as well. And somehow or another, I just wish it was all linked up together. But bridging the gap is something that, we're really, it's getting worse within North Tyneside. We know, particularly in educational attainment. We heard a report recently. So where would you see your report at the minute, your presentation, linking in to tackling that problem, please? Sorry, is that a bit out of the thing? It's just my thinking sometimes when I hear these presentations. Okay.
So sorry, Councillor Green, I got cut off, so apologies for that. But I think I've got your questions. I think that there's two elements that we know are really important and implicit within this strategy. One is the ambition around education for North Tyneside, and so there is a separate work stream that is basically really focused on what you've been talking about in terms of the gap, both around education, but some of the wider social determinants. So there is one work stream that is very heavily focused on that. And I think that equally that plays into the work that we are collectively doing across North of Tyne with both Newcastle and Northumberland. So hopefully some of the detail on that will give you some assurance that we are trying to actively address that. I think that your point is well made around, some of the wider determinants, and in particular housing and some of the other agencies that are really important. And I think that we're by no means complacent, but I think that one of the strengths that we do have is that single point of entry for where we've got families that do have needs, that do have concerns. When they are referred into social care or into early help, what we have is a strong mechanism for collaborative working. So in other authorities, what you might find is that if you refer where you've got a concern about a family and you refer in some authorities, it goes into just social care and they look at it through a social care lens. Whereas the opportunity in North Tyneside is that we've got, I think in total, about 11 partners that actually sit together and do that assessment and do the triage around the family, and housing a part of that. You've got domestic violence, you've got education, so you've got a whole raft of different professionals who at that single point look at it through a slightly different lens. And I think that in some ways that helps us to give a preventative approach and get in early in supporting families, but also it's in terms of information sharing. And so I think we've had previously whereby families might get into an eviction. I think that where you get
lost you a bit now. Is that Margaret trying to come back in, Michael? I've lost Jackie altogether now. Margaret?
Yes, is Councillor Hall with us again?
She was for a second there.
Can I suggest, Councillor Green, you just continue to conduct the meeting?
Sorry, Wendy. Wendy's frozen. So Jackie. We've lost Jackie.
Yes,
Is there
and
anyone else wants to ask a question?
We'll have Councillor Samuel, Dean Titterton and Councillor Wilson have all indicated they wish to speak.
Right. Councillor Samuel first and all, please.
Thank you, thank you, Deputy Chair. Yeah, just to say, I mean, it looked quite an impressive presentation to me, and there wasn't much I could argue with in there. But the only part that my question was going to be before I saw your final slide was about evaluation, and obviously evaluation and obviously making sure that you've actually met the targets and that sort of thing. How do you intend to do that? Is there regular reporting back on achieving targets and meeting milestones? Because I mean, the best plan in the world doesn't get you anywhere unless you're regularly evaluating how it's working out and how it's being observed.
I mean, it works. If I could reply to that one, it works at a number of levels. So yes, certainly on my last slide, I touched on the report at the kind of strategic level through the Children's Board. We will look at the overarching work plan. But if you were to look at any one strand, if I was to pick special educational needs and disability, we have an SEND board that Leslie chairs. We have done an extensive self-evaluation. We've got an action plan. We've again got the metrics there. We've got a lot of evaluation. We work with a number of lead agencies. So, for example, in special educational needs, we've been doing a lot of work with the Council for Disabled Children as one example in terms of testing out our thinking, testing out our models, looking at our processes and systems, as well as the impact that they have significantly on, on children, young people and families. So whether it's from working with universities, working with national agencies or others, we certainly are ensuring that we are delivering the outcomes, but equally we're testing ourselves around innovation and best practice as well, really. So there is that cycle of improvement, both kind of compliance and outcomes, but equally quality improvement and kind of being innovative as well is what I would say to that one.
So there's a degree of benchmarking then from what you're saying.
Is that all, Sally, Willie? Councillor Sally? Yeah.
I was just asking if there was any benchmarking going on as well.
Benchmarking.
Well, again, I would say if I was to pick a different example in the world of children's social care, we have spent a lot of time recently looking at our social care metrics. We know where we stand against all local authorities in the region, our statistical neighbours and the national average. So we are in a position to understand what's been the impact of the pandemic on children's experiences, on safeguarding children coming into care. And that's one of the areas where we do stand in really good comparison in terms of regional benchmarking. We benchmark for outcomes, we benchmark in terms of spend and budget, and so we've got a fairly broad composite way of I guess assessing ourselves against others to know how we stack up. We don't have a more insular view of what we're doing. We have a kind of expansive view of how it compares with other areas.
If I could just add to that, Councillor Sammy, and just give you some assurance. So two things. One is that just last week we had our annual conversation with Ofsted, who clearly have a strong performance element in terms of the authority. And one of the comments there reflected back to us was the level and scrutiny that we have around performance information. And I think it's fair to say we count and measure lots and lots of things, and that is in a very strong place in terms of how we measure it, but also kind of on a weekly, sometimes daily basis, we're looking at it in terms of benchmarking. And as Mark says, most of the indicators that we have are in kind of the top performing authority. So that's one element of it. I suppose that the other reflection that I would say is that you can count everything, but actually the thing that's most important and probably the litmus test for us is what children and young people say about our services. And I think that for me, we have so many mechanisms to be able to test out with young people exactly what they think and what they see in the services. That's probably the most important indicator that we've got.
Okay, thank you very much.
Right, thank you. I've got Councillor Wilson and is it Dawn? The other one, Councillor Wilson, please.
Thank you. Yes, I think it was Dean Titterton was the other person wanting to speak. So yeah, thanks Mark for the presentation, and thanks Jackie as well for the work on this. I was really pleased to see those 5 I's so central in the plan. I think the reason why is that big strategic plans like this, they can be a bit dense. And I think it's just such an easy way to connect with for all the stakeholders who'll be involved in delivering a plan like this, that Five Eyes framework. But actually, it can be communicated to children and young people as well. It's sort of in their language. I really like that in terms of this being a plan that they feel is their plan as well. So well done on that. I think if I had anything I'd like to sort of raise as just a little bit of a flag, within the whole sort of 15 pages of the report, I found very few mentions of parents and of families. And so just a reminder, of their centrality in raising healthy kids in the borough. And perhaps it would be good for the plan to acknowledge more clearly, that as a protective factor.
There's a comment on that, Mark? Mark?
Well, firstly, thank you very much for the positive perspective on the Five Eyes, and indeed that really is important for resonating with children and families in that respect. We certainly do a lot to understand the context which children are growing up in terms of family, in terms of parents, in terms of carers support. Absolutely, we do work very closely with parent carer forums and ensure those arrangements are there. But I think certainly we're happy to review that and see if we can consolidate or strengthen any of that. Or indeed, it's probably that many of the things that we take for granted that are actually in the work plans in each of those priorities, there are multiple examples, and whether they come to the fore in the high level strategic plan, maybe we could do something to strengthen that. So thanks for that feedback. Thank you.
I think similarly, if I can just add to that, I think that I mean, it's really important to play that back, because I think that sometimes when you're so near things, you almost take it for granted. And I think that the partnership work that we've got is so much based on parents and families and that strengths-based approach, and it's almost kind of in the DNA of what we do. So it's important that probably you have reflected that back, and we will make some amendments. Thank you.
Okay, right. Thank you very much. Now there's a third person, Dee.
Yes. Thank you, Councillor. I'm absolutely quite I'm actually quite gutted, because I stuck my hand up before Matt and he stole a bit of my thunder, but I thought I'd got my hand up before him for once in my life. But no, Mark and Jackie, thank you very, very much for what I think is a very strong report and a strong presentation. 3 quick observations, if I may. One is the one on the point that Matt just made around families. When I pre-read this report to the meeting, I did make the note around, as an organisation that works with young people, the whole wider determinants of working with young people, families is becoming more centric to that, whatever that family unit looks like. So I think in your presentation, Mark, you use the word families quite a lot. So I do think, just backing up what Matt said, being a bit more explicit about families in terms of the priorities going forward is really key. That was my first one, but I think Matt said quite well there. 2 other quick observations, if I may. You've made mention in the healthy bit around Active North Tyneside. Now, I think as a brand, Active North Tyneside is really, really good, but we do talk about in the plan also about partnerships and wider partnerships. I think this is just a wider challenge. I think there's quite a few organisations out there delivering health and healthy activities, but yet probably aren't consolidated or part of the Active North Tyneside brand. And I think there's a bit of work to do there if we're going to look at some type of cohesive work. I think obviously at the moment, the Active North Tyneside brand, as we talk to young people, is very much council centric. I think there could be just some more, a better approach to work with other organisations around that. That's one observation. And the other one, the third one, is just a micro one. On the 5th priority in mental health, you talk around the measures of success, and you talk about referrals to mental health services. Now, in the priorities, in the outcomes bit, you talk about specialist mental health services, but in the actual outcomes framework of point 6, you talk about just referrals to mental health services. And I know it's just a micro thing, But as we're working with lots of partners, and I'm sure Wendy will vouch for this, and working with primary care networks, we are looking at a greater work of other organisations that may not be specialist mental health services working to affect young people. Now, if this is the case, that will probably be ongoing. So I think the measure should be explicit in the framework to mention specialists, if that's at all possible, because I think there is wider tier 3 stuff that will be ongoing.
Okay. Anyone else want to make comment or ask questions? Any officer want to add anything to that detail? That's been a really, really refreshing exercise this afternoon. I think we've learned an awful lot. It's sound, it's very detailed, as always the policies are that we come out of North Tyneside Council anywhere, or anything to do with North Tyneside. Michael, what do we have to do to finish this off? Are we just accepting this report?
I don't think there are any specific recommendations, Mark, are there? I think there's an open invitation for members to provide any feedback to Mark Jupp as set out on the final slide.
Right, okay.
And I think Councillor Hall might be with us again.
Is there another slide, is there?
No.
Just the final slide of the presentation, Councillor Green referred to an email address to send any comments to, but I can share that again after the meeting.
Okay, right, thank you very much. I'm not sure where we're at with the agenda, Michael. I don't have it in front of me now. Is there anything else on the agenda?
I think yes. We're now moving on to Health Watch North Tyneside, but I think that might be Councillor Hall return to the meeting.
My apologies, totally out of my hands, bit stressful.
Right.
Can I move now to item number 7, and thank Muriel very much for chairing that. And I'm sorry I missed nearly all the presentation. Paul, would you like to do your presentation? And I'm sure members will come in after that. Thank you, Paul.
Thank you, everybody, and good afternoon. I've got a short presentation for you, and then we'll take questions afterwards. I think it's been circulated this morning, so I don't intend to read every word on the slides. Don't worry. I'm just going to try and share my screen. Oh no, that's the wrong thing. That's always helpful. Sorry. I don't know what I just shared then, but I hope it wasn't too controversial. There we go. Can you see a set of slides that say December 2020 update? Excellent, marvellous. Let's say. So, as you know, thank you very much for your time at this meeting today. We usually twice a year come along and do a bit of an update about the work that Health Watch has been doing, but also what we've been hearing. Obviously, it's been a very unusual year this year, so I think this is the first one in 2020. But we did have a presentation in September about some of the stuff that we've been going on. So what we've been doing, obviously, during a lot of our work has been changed to reflect the pandemic, coronavirus, and helping people to get access to information, understand people's experiences of health and care services during the pandemic, and then feeding that work in to the providers and commissioners, both on a day-to-day basis so that they can improve services as they're running, but also feeding into the kind of locality plan that Leslie and Scott talked us through about earlier. So we have been feeding kind of, as we've been going, feeding information back through to the system so that they can respond hopefully quite quickly to the needs and issues that people are raising with us about. Some kind of quite important stuff to kind of be aware of, though. During the pandemic, a lot of people told us how difficult it was to find detailed, up-to-date information that could be trusted about what was going on. Services were changing incredibly rapidly, particularly in March, April time, and there was a real issue about kind of getting kind of trusted information. So we created a bit of a service information hub on our website and shared that with partners and things like that. And I think that was incredibly well received to kind of help people to understand what was going on across the board. It was a bit like painting the Forth Bridge, if I'm honest, because everything things were changing very regularly, so it needed updating. And we've still got that now, and we're doing our best to keep that updated as much as we can. And that providing information for people was really critical, particularly during the first lockdown, but continues to be a core part of our work, be it through the kind of useful contact stuff that we've done and put through a couple of thousand doors across the borough, of content into the navigating the new normal and things like that. During the pandemic as well, particularly the height of the pandemic in March to July, we also helped others to respond more directly in some of the frontline work that was going on. Because we had a bit of spare capacity as a team, because a lot of our face-to-face work couldn't obviously happen. So what we did was we supported North Tyneside Carer Centres to do a lot of check-in calls with their service users, with carers across the borough. We helped out with Voda's Good Neighbours project, both in terms of food delivery parcels and in terms of delivering prescriptions, and we're still doing some of that work now in terms of delivering prescriptions, and I'm just back from doing one at lunchtime today. But all of this has helped us kind of gather people's experiences and as I say, share that information with people as we've gone along. It's been a bit of a challenge for us because moving online, as we've talked about earlier, remote working and things like that has been a challenge. We've not talked to as many people as we normally would, because none of the community events have happened that they would do over summer and things like that. And I think that reach is a real challenge for lots of different organisations, particularly voluntary sector organisations as well. That link there is a really lovely film that Voda, one of the recipients of the food deliveries, has put together about their experiences during lockdown. And I suggest, I'm not going to play it now because it's about 5 minutes, but I suggest you take some time to kind of watch that yourselves, because it does bring a tear to your eye, but it does understand the experiences that people have had during lockdown in particular, and the support that was helped them through that difficult time. I think generally, kind of looking at the kind of what we've been hearing and the mood that we're kind of picking up on and things like that, I definitely think November was a very good month in terms of hearing about news about the vaccines and things like that, and that's definitely people talking to us about the light at the end of a very dark tunnel and things like that. So I think people are feeling slightly more hopeful about the kind of end to this kind of very difficult period. But still very frustrated about the kind of how long this has been going on for, and thinking back to when it first started, and we all thought it'd be over by summer and things like that. So there's a lot of frustration in there, and people are tired and ground down, I think it's fair to say, by this, as I'm sure many members of the board are feeling individually if we think about it ourselves. They are incredibly grateful for the work of the NHS and key workers and care providers. I think that's absolutely fair to say. Remarkable support out there still. And there is a recognition and acknowledgement that it's been a difficult time, and particularly for people who've kind of got ongoing health issues or been waiting to access services and things like that, that there are some real challenges, while the focus has been on supporting the action around the pandemic. And I think we're starting to see a little bit of frustration growing that services, that health and care services aren't kind of working quite the way that people want them to, that some people are still waiting for access and things like that. So I think we're starting to see a little bit of that kind of frustration going on, which is interesting as it kind of flowed, particularly over summer, when some of the kind of lockdown measures kind of were eased a bit, and some of the things were starting to get a bit more back to normal, and people felt, well, if I can go shopping, then why can't I go and access this service and things like that? And obviously, so that's been a challenge to kind of understand and to kind of keep an eye on that in a kind of general mood kind of thing. More specifically, We've talked already quite a bit about digital access and digital inclusion. It's something that I have been banging on about for quite a while now, with the support of Dawn from Age UK and various other people, about the importance of digital access, the huge shift to remote access of services and digital first approaches during the first lockdown, and the sense and the real feeling that a lot of that will be here to stay for forevermore. That's been a massive shift in the way services are delivered. There's some real benefits to working online as well, but some people are certainly saying that feeling that some people are being left behind, and that there are still some real issues in there about accessing that. And I do appreciate the work, particularly of the CCG and the council, around helping to take this issue incredibly seriously over the last few weeks and months, making sure that it's embedded in the plans and putting some money into really understanding the issue, as well as supporting activities now, digital champions, how-to guides, kit loan schemes and things like that, to kind of help people in the short term while we kind of understand the issues better. And part of the issue that I kind of spoke about earlier was about trusted information and easy to access trusted information as well. And I think it's fair to say that we'd hoped, or one would have hoped, that the Sign website and the Sign network would have been a go-to place for this. But I think we all recognise that it's had its day, and it needs to be it's very dated. Some of the content isn't quite right, and we're missing a huge opportunity to kind of provide a better access to information. So there's a partnership, members along there, including a few others as well, and who are looking at pulling together, who are working at the moment to develop a replacement for the Sign network, which will be called Living Well North Tyneside, and it's going to have up-to-date information about local support and services, promotion of kind of key health messages, information about healthy living and lifestyles, well-being, volunteering opportunities, how you can get involved with other communities' activities and things like that. We've got a bit of money from the lottery to help do this, and a lot of money actually via the CCG, I think it's through NHS Digital, through the CCG, to help do this work. And we're hoping that the new site will be launched in June, and then ongoing developments throughout June 21. And we're doing a lot of work with the partnership boards, like the Carers Partnership Boards, the Ageing Well Board, and things like that, to look at how the new Living Well site can be used to better communicate information to people. Because one of the things that we hear as an organisation at Healthwatch is access to information is really critical and is a real problem at the moment in the North Tyneside system, if we're being honest. So the Living Well North Tyneside site is going to be incredibly helpful to resolve some of those issues, we expect. Some of the work we've been doing more recently, is we published a report back in October, which was focused on experiences of dementia and memory services. This was based on speaking to older people and family members and carers pre-COVID, but we worked really closely with the Mental Wellbeing and Later Life Board. Age UK and the Carer Centre was incredibly helpful in doing this research, as was Northumbria Trust, and thank you to them for their help with that. There were some key findings from that report involving crisis planning, improving care coordination, again, information about what support is available and things like that. And really the importance of those support services, including peer support groups and adult nurses at the time, that have been used now to help shape an action plan that's been developed by the Mental Wellbeing Later Life Board, feeding into the Ageing Well strategy and the community mental health transformation plans that we heard about earlier. So that feedback that have come directly from users, working in partnership with partners around the table, is really helping to kind of formulate those plans and to take action to improve the services for people. Similarly, as you know, as we always talk about when I'm doing these kind of presentations, access to GPs and primary care is the number one thing that we always hear about. It's the most popular topic of conversation when we're having conversations with folk about their experiences. And we've been gathering evidence from people, experiences from people before COVID. And earlier during the kind of spring lockdown, and we're planning to do some work jointly with the CCG, Primary Care Networks and the Community Healthcare Forum over the coming weeks and months to gather some more recent experiences now, so that we can do a bit of a longitudinal analysis of change over time to people's attitudes, particularly around triage, remote access, the importance of continuity of care for some people, the importance of getting care quickly when they need it for other people and things like that, and looking at how people access things via video calls, online forms, phone access and things like that. So that's very much a work in progress, but we did publish a report back in July which highlighted some of the important things about triage, and actually a huge willingness back in July for people to use phone consultations with GPs and other health professionals, and video calls as well. But how important it is to still be able to do face-to-face appointments when people think it's important and professionals think it's important too. Again, we've done quite a lot of work over the last couple of years around understanding where people go when they're feeling ill and what people do. And one of the key things that I've talked to you about before is about people feeling confused about what services are available and how to access them. And we were reflecting over the summer, particularly since the ICS's Do the Right Thing campaign, where people are being asked to kind of go to ring 111 or contact pharmacy or GP before they attend urgent and emergency care, unless it's absolutely urgent. Then we kind of pulled together a bit of a leaflet and put together a short film that the CCG have helped promote, which kind of explains to people the different ways that you can get healthcare when you need it in North Tyneside, and help people to navigate the different services that are available for us, and how to do that, because some of the access points have kind of changed and evolved a little bit. We've done a really lovely piece of work, I think, with North Tyneside Carer Centre to understand carers' experiences during COVID. As I said, we worked closely with them during that period of time, and we took the opportunity to do some joint research. And those findings have been presented to the Carers Partnership Board, the Living Well Locally Board, it's been through the Future Care Board and various other places. The key things were around access information, access to support, carers feeling quite isolated and not knowing where to go, particularly during that first lockdown when a lot of the services were closed. Some real issues around behavioural carers who are looking after people with challenging behaviour, particularly parent carers and carers with dementia. And I know there's some work and some investment going in through the CCG and North Tyneside Council to support that, to support particularly parent carers at the moment. There's some challenges around being informed about loved ones and how they are doing when the loved ones are in a different care setting, and some challenges around the sustainability of the caring role. I think carers were telling us that they felt under a lot of pressure. They took on probably more responsibilities during lockdown. There's a sense that that is continuing, certainly, and there's a pressure that builds over prolonged periods of taking those additional responsibilities that are kind of that carers are starting to feel, and that links to crisis and crisis and contingency planning in that kind of way. So this information has been shared, as I say, with the council, and I know the adult social care teams have kind of looked into this and kind of taken some action. I think people really appreciated those checking calls that the social care teams were doing, and the carer centre and the support hub as well during the kind of lockdown as well, to make sure that carers were supported in that kind of way. Just a couple more minutes. We're currently doing some work around pharmacies and deliveries of prescriptions. I think during lockdown it became increasingly important, clear that the delivery of prescriptions is really important for people, although it's not a right, it's not something that's commissioned, it's something that pharmacies do. So what we've done is put together some information for people to understand what services are available locally. We're just publishing the newest version of that later, early next week, and some frequently asked questions as well. And we're gathering people's experience of getting prescriptions, because we know that some people are here. We're hearing that some people are having increasing challenges to get prescriptions, and some pharmacies are under particular pressure at the moment. So we'll kind of gather some more information about that. Similarly, I think we've heard from nearly 100 women who are pregnant and families who have young children about their experiences of health and care, particularly around the kind of pregnancy and support for their child. And we will be producing a report feeding kind of key issues from that out back in January. Something that we're just about to start to do is trying to understand people's experiences of waiting for treatment. We've heard a lot of people who are waiting for treatment. Some have been waiting for quite a while. Some real issues around dentistry, audiology services, ophthalmology, and things like that. And Healthwatch England have just produced a report earlier this week around, which is helpfully entitled "COVID-19 Pandemic Pushes NHS Dentistry Crisis Point." But I think there are some real issues locally about some of that waiting, and I think we want to understand some people's experiences in a bit more detail and understand what would help and support them and how well they feel informed and supported whilst they've been waiting to access services. And finally, there's some work going on at the moment around coordinated care and hospital discharge, and I've got a chat with Northumbria next week to go through some of the feedback that we've been hearing recently about family involvement and things like that. And I think it's really testament to people being open to hearing feedback directly from people and feeding that into services. We're doing quite a lot of work around mental health at the moment. We're about to publish a new version of the mental health support leaflet, which I know GPs in particular have found really helpful. And there is a video on our website that the young people at Phoenix Touch Youth Project have pulled together, which is talking to a guide for GPs about how to have a good conversation with a young person about their mental health, which, as we mentioned earlier with the Young People's Plan, is a real critical thing. The young people wrote the film, pulled it together. It stars a local GP from New York practice, and it's a really lovely thing, and it's being used in GP training, I think, at the moment. And finally, one of the things that we're kind of hearing a lot about at the moment is around care homes. We've been gathering people's experience, relatives' experience about having family members in a care home, key things around visits and flow of information, and we've been doing a lot of work with North Tyneside Council about that and thinking about some future engagement activities as well. So I will stop there. I'm sorry, I don't know how to stop sharing. Happy to take any questions, Chair, and I'm sorry I don't know how long I went on for.
Thank you very much, Paul. Do you know, every time you do a presentation, I'm always struck by the range and the amount of work that you do in Healthwatch. And I think all of it useful, all of it informative. Thank you very much, and
thank you.
A happy, prosperous working year next year. Right, any questions? Muriel and
yes, thanks very
Councillor Samuel. Right.
Very meaty, very informative. Couple of questions. Do you say that sign is not going to be operative very much more? Because that came in through CAB, didn't it, really?
Yeah, I think the sign was a little bit before my time, if I'm honest, and there'll be people at this table who know more about sign than I do, like the origins of sign. But I think the Sign Network is a group of organisations who do signposting and helping people to get access to information and support and guidance that they need. that will evolve into this Living Well in North Tyneside platform. So all of the members who are currently part of SIGN and the information that is in the SIGN network at the moment will be updated and made to look prettier and more user-friendly, and will be transformed into the Living Well on North Tyneside kind of directory. So it will do the same thing as SIGN and a bit more as well. And we're hoping that will be put into place by June this year. This coming year.
It's an incredibly difficult thing to keep updated because people keep forgetting to add when changes of personnel have taken place. So I really wish you all the best of luck, because that's something which is really very important, very vital to things. But congratulations on the work you've done. You seem to have done a lot of
the SIGN network is definitely a true partnership collaboration. Ruth Batty at the North Tyneside Council, the CCG, the primary care networks have done an immense amount of work on it, and Voda will be leading on it going forward. So it's a great piece of partnership working, to be honest.
Excellent, thank you.
Councillor Samuels, please.
Hi. I just wanted to ask a couple of questions about Livy. Obviously, when that first was introduced, there was a little bit of controversy about it and some confusion as well, because we were told it was an experiment and then it was to be permanent, and it never seemed to be. I mean, unless I'm not a permanent member of this board, obviously, so perhaps it was resolved in some other way that I don't know about, but it didn't seem to be to my understanding, and we are concerned, obviously, that has the potential perhaps to be taken away resources, etc., and finances from the GP practice itself. So I just wondered where we were with that.
I think Leslie's probably best placed to respond to you, Willie, than myself. What I would say is that I think the things that we've kind of highlighted is that there was an increasing need and increasing desire from people locally to have different ways to access primary care, and some of that reporting is in there. But Leslie, I think you've got your hand up. Do you want to come in at this point?
Leslie?
Yeah. Yes, thank you, Chair. That's kind of you. Yes, we've already done sort of frequently asked questions, and we've been to the OSC in respect of this, Willie, but I appreciate you wouldn't have been there. So just to keep it brief, just to give you the assurance, it's a pilot which is evaluated, and we'll have a multi-organisation stakeholder, including a councillor from the OSC, on the steering group in terms of looking at the impact. Depending on the impact of Livy, we will make a decision together as to whether or not we continue to commission a service like that. But I want to give you the assurance, the same as I did with the OSC, that we have already, prior to going down the Livy route, we had already invested significantly, recurrently, more money than we needed to into practices. So there's a national ring-fenced budget in line with the GP contract, which is paid across from the CCG. In addition to that, the CCG identified resources from its wider budgets to invest recurrently into practice to enable them to improve access, improve the well-being of staff, and improve patient experience. And in addition to that, we invested another couple of million in relation to GPIT infrastructure. So I'm more than confident to say that this has not and will not take away any money from our GP practices. This is about enhancing the offer to access to practices in partnership with them.
Thank you.
Okay, well, it's possibly not the forum to pursue that at the moment, but thank you for the answer.
I would suggest that. Councillor Mulvenna. Hello, Tommy? No? Anyone else wants? Councillor Mulvenna, do you want to speak?
Camera work. Oh, I've got it working. I've got two questions. First of all, can we have copies of the slides, because it's very interesting, but it's a lot to take in when you haven't got the copies of the slides. And the second question is, again, around the digital experience. Do you think we're now starting to get to the stage where might be that the partnership needs to be looking at a dedicated member of staff in order to keep it all up to date and running. That might be beyond your pay grade, you know.
No, no. I can. Well, most things are, Tommy, if I'm being honest with you. Yeah, I think the slides have been circulated, but I'll certainly send them over to you again. They only came around this morning, though, Tommy. To be fair, so you might not have got them. That was my fault, and I'm sorry about that. In terms of the kind of sign network, are you referring to the sign network and the kind of the living well locally? Yeah. Yeah. So there is money within the budget and the recurring budget for a member of staff to kind of oversee the ongoing running of it into the future, and that money's been contribution from the council, from the CCG, from the primary care networks, and we put in a little bit, and voters put in a little tiny bit as well between us to kind of help to help that kind of going along. So there will be a member of staff to kind of oversee the running of the kind of living well locally network as it goes along. Quite how it's going to work, we're still working that through now. So we're having lots of meetings at the minute to kind of work through the details of it, how it's going on. We've only just appointed the website developer last week, so it's still kind of still a lot of details to work out. But we're all very excited and very hopeful for the future, and we've got about 6 months to get it right.
It's just, I think it's very important, because if you think about it, communication was touched on in the last presentation, and also was raised by Dean from the YMCA. And, you know, if we could enhance what is already there to make an even better future project, as it were.
Yeah, absolutely. Thank you.
Thank you. I have no indication if anyone else wants to speak. Just in case I've missed anyone, then can I thank you very much, Paul, again for such a good presentation and a picture of what you and your organisation has been doing on our behalf. Thank you very much. Can I move to item 8 now, the COVID-19 update? And I think Wendy and Leslie are taking us through this. Thank you very much.
Thank you, Margaret. I'm going to kick off with a presentation, and then I'll let Leslie come in when I've gone over the data, if that's okay. I'll just share my screen and bring up the presentation. Can everybody see that?
Yes, I can. Yes.
Okay. Okay. So so the impact of COVID, the last time we came to the board in September, we were sharing the impact back in September, and you know we continue to see the impact of the pandemic right across the population, not only in terms of health and well-being, but also in terms of social impacts, and in particular the economic impacts right across society. So there's not a bit of society that's escaped the impact. I'm just going to go over some of the up-to-date data and show you some of that. So in terms of the epidemic curve for North Tyneside, this is what the epidemic curve looks like. This is the most recent data. So the infection rate since we've been in that 4-week lockdown period, and since we've come out of it, has certainly come down. We've got a downward trend. I think what we haven't seen yet is that we haven't seen the impact on the infection rate from the change in restrictions on the 2nd of December. Yeah. So I think it's very early days in terms of whether or not that downward trend will continue. But certainly the infection rate now sits at 119.3 per 100,000 population in the most 7 recent days. And that is a significant drop, as I've said, since we were in the 4-week lockdown period, with 248 cases in the last 7 days. In terms of the infection rate by age group, there's a bit of variation there, with the lowest infection rate in the 0 to 14 age group. I am still a bit concerned that the infection rate in the older population is still a bit too high, so I'm a little bit worried about our over 65s, but on the whole, it's a downward trend across all of the age ranges. In terms of the testing data, we continue to test a significant number of people, even though we are seeing a reduction in the infection rate. So in the last 7 days, we've tested just over 5,000 people. Of those tests, as I've said, 248 were positive, which gives us a positivity rate of 4.61%. The positivity rate has in the past been much higher. It's been as high as 15%. So the positivity rate is certainly, again, going in the right direction. In terms of the cumulative impact across the borough, it shows a very unequal picture now that we've got such a lot more data than what we had. In terms of rates and numbers, there's a disproportionate impact, particularly in the dark blue areas of the borough, which are largely Collingwood, Churton, Riverside, Howden, some of Long Benton and Camperdown, and a much less impact across that whole coastal strip. Of course, the reasons for that are very clear, because we know that poorer outcomes from COVID are associated with increasing age. If we took 1,000 people, if they were under the age of 50, we would expect none of them to die. If they were aged between 50 and 60, we would expect about 6 of them to die. And if they were over 70, we would expect 120 to die. And therein lies the differentiation in terms of that increasing age and the impact. We know that males are much greater impacted by COVID-19 and have poorer outcomes, similarly to our Black, Asian and minority ethnic groups. And we know that certain occupational groups, particularly those that are lower paid, so bus drivers, taxi drivers, social care workers, again, are at risk of greater exposure of COVID-19 and, of course, increase in deprivation. And the increase in deprivation, again, is linked to that increased vulnerability of underlying health conditions, exposure to adverse socioeconomic factors, as I've said, inequalities in working conditions, and also poorer housing conditions. In terms of the impact on the NHS, this shows the current picture within Northumbria. And again, we've got a declining trend in the occupation of beds in the trust for COVID-19 patients, which is good to see because it did hit an all-time high. But it is a downward trend, as is the downward trend of occupancy in high dependency unit and ITU. So that it is an increasingly improving picture. It's a similar picture. I know there's a lot of information on here. I apologise. For Newcastle upon Tyne Hospitals Trust, it's a similar picture. These are the two graphs that are probably the key, showing the downward trend in the occupation of beds and the lower trend for high dependency and intensive care beds. I think that's a really pleasing picture, but I think both trusts, and I'm sure Claire will reiterate this, are very worried about one of the busiest months of the year, which is January. So they're very worried about the impact on the NHS in January. In terms of the deaths to date from COVID, we've got a total of 229 deaths where COVID was mentioned on the death certificate, and 74 of those deaths have happened in care homes and 139 in hospital. You can see from the chart currently we're showing death rates above the 5-year weekly average. And although we did dip well below that at the minute, those rates have gone up slightly, which is not surprising given where we've been with the infection rate in the last few weeks. In terms of the outbreaks across the borough at the moment, we've got 47 live outbreaks ongoing across the borough. Predominantly they're in schools, care homes and workplaces. So 19 in schools currently, 10 in the workplace and 11 in care homes. They're spread across the borough, and again the impact of those outbreaks is definitely slowing in terms of the last 2 to 3 weeks, which is pleasing to see. We are feeling that decreasing infection rate. In terms of the new national tiers of restrictions, I get a lot of questions about the R rate. What's the R rate at local level? The R rate is not a helpful statistic at a local level, and that's largely because it's not a direct measure. So there is a lot of uncertainty around the exact value of R. and it tends to be used at a national level and a regional level. We don't use it locally because actually we've got much better data at our fingertips that gives us a much better flavour of what's happening at a local level. So there are currently 5 measures that are being considered by the government to determine the level of restrictions needed for each area, and they're the number of cases across all ages in the population, the number of cases across over 60s, how quickly the cases are falling, the percentage of tests that return a positive result, and the pressure on the NHS. And all of that culminates into a picture for the Secretary of State and the CMO, and a decision is then made on what tier each local authority needs to be in. Of course, there's a big review coming on the 16th of December, and we await to see what happens as a result of that review. So the work, we continue to do a huge amount of work preventing and containing the spread of the virus. That includes, making sure our workplaces and settings, businesses are COVID secure, that we're focused in on the high risk settings, that we're making sure we've got sufficient access to testing, making sure people who need to isolate are doing so, lots of communication and engagement with communities, and ensuring compliance with our North Tyneside Marshals, which they started in post a few weeks ago, and using enforcement where necessary. A big piece of work with the community and voluntary sector, particularly through VODA, and they're recruiting this week for community COVID champions, which is great news. In terms of new developments, a communication campaign is being launched. It's actually this week. This was a slide from last week. New campaign, which is basically thanking the people of the North East for everything that they've done so far in containing the COVID-19 infection and disease, and that campaign is really welcome. And it's a very good campaign. It's based on a lot of underlying work that's been undertaken by Drummond Central, with focus groups and people from the North East. And we hope that that will continue to have the impact that it needs to have. In terms of rapid testing, there's a lot of information out and about at the use of rapid testing and rapid testing devices to identify people who don't have symptoms but may be spreading COVID-19. So trying to get to those people to make sure they self-isolate. So we've got the use of lateral flow devices in care homes to support care home visiting as a risk reduction method. And we've also got the implementation of community rapid testing, which is on offer to all Tier 3 local authorities. And we're just working through a plan at the moment in North Tyneside for a community rapid testing site to be set up in January for a 6-week period. We are supporting the care homes where they are able to use the lateral flow devices for care home visiting as well. And lastly, the new development and a lot of attention around this is the vaccination. I'm not going to say very much about that because I'm going to let Leslie pick up on that and she'll tell you a bit more about it together with Jackie. The vaccination is great news, but until we've got widespread rollout of the vaccine, my 6 key messages remain. So hands, face, space. Limit your social contacts because the more contacts they have, you're greater at risk of COVID-19. And self-isolate with your household if you've got symptoms, or self-isolate if you've been in close contact with a case. Those 6 key things remain absolutely critical at this point in the pandemic and will continue to be critical for the months to come. Thank you very much.
Thank you. I'm going to ask. Pardon? Oh. I'm going to ask Leslie to do a press. I have an awful feedback. I'm going to ask Leslie to do her presentation, then ask for questions to both. I think that would be slightly quicker way of doing things. Are there any questions? Could I ask Leslie to do her presentation? Thank you.
Yes, Chair. Thank you very much. I'm just going to add a couple of things to what Wendy said.
I'm having a bit problems hearing.
that, and we'll continue to work together to support whatever the actions required. I think particularly
Leslie, we lost you a bit there.
Oh, can you hear again? Oh, God,
You might
we're
need
all
to
having
say
the
that
same
again.
problem. Okay, can you hear us now?
Yes,
All
yes.
right.
Could you start again? I
I
certainly
will
missed the
do.
start.
Sorry,
Thank
it's
you.
hard. Thank you very much.
Yeah.
Yes, I'm just going to say we all share the same concerns that Wendy's articulated in terms of the pressures on hospital and community systems and GP surgeries over the winter. Particularly given that we've got 2 long bank holiday weekends, and the most important thing that we need to do is as a system is just to make sure that we echo the hands, face, space, limited contacts and isolation, and being in contact with a contact of a case, self-isolate for 14 days, because increasingly we're seeing people just being a little bit lax in relation to that. I think people are getting weary and just getting a little bit sort of gung-ho as we lead up to Christmas. The most important thing we need to do over the Christmas period is to make sure that we manage our hospital flow and make sure that we continue to get patients being seen in the right place at the right time. All of the messages in terms of talk before you walk will help with that. As you know, there's been some significant changes into the original plans for the COVID vaccines. Our COVID hub for our region, or our ICS, is Newcastle upon Tyne hospitals. We had Northumbria Healthcare Trust ready to stand up their vaccination programme this week, only to be told that they were going to be paused whilst primary care networks needed to stand up their COVID vaccination hubs, which is most unfortunate, because that also provided us with the opportunity to get some of our vulnerable older people vaccinated within the hospitals, as well as our care home staff. Nonetheless, our PCNs have worked with public health, with the trust, with our other partners, to stand up 3 COVID hubs, which have been approved now, and our first vaccinations there will start on the 21st of December. Our 3 COVID hubs that have been approved for North Tyneside with the PCNs and the GP practices as part of that are the Parks Leisure Service in North Tyneside, obviously in North Tyneside, sorry Chair, in North Shields. We've got the Oxford Centre in the Northwest. And we've also got, I'm just trying to think of the name of the school again, it's gone out of my head. I'm having one of those days. Wendy, can you? Langdale, thank you. Yes, unfortunately, despite the very kind offer for the Shire Moor area, that wasn't approved just due to flow and car park, and so we're looking to get the Shire Moor Resource Centre authorised, but that hasn't been done yet. So the first vaccinations are going to be given in the Oxford Centre, and the others will roll on in line with the national requirement. I think, in fairness, I'm going to leave it there, Chair, because I'm conscious of time, and I'm happy to answer any questions in support of Wendy.
Thank you. Members, have you any questions? Anyone indicating? I think we're all fascinated by those 2 presentations, and of course, I don't think I'm the only one that's very interested in the vaccine and the rollout of the vaccine. Do we all declare a personal interest? I'm not sure, but definitely important to us all, and important to the way life starts turning back to normal. I have no indication of anyone speaking, and anyone want to ask a question? If there isn't anyone, can I thank everyone who's contributed to this meeting this afternoon. I do think we've had a lot of very clear, very good information in front of us, and it does give us the opportunity to think deeply about how, as a health and wellbeing board, we continue on into the future. So I suppose it remains for me to say, I hope everyone has as good a Christmas as we possibly can have, missing our families as well, but Please look forward to next year. It must be better than what we've had this year. So thank you very much. I think that brings us to the end of the meeting. Thank you.
Thank you.
Thank you. Happy Christmas,
Thank you.
everybody.
Thank you.
Thank you very much.